Welcome back to The Link. We are delighted to welcome again to the set of The Link, Lou.graner, Executive Director, Coweta Samaritan Clinic. Lou, welcome back to The Link.
Thanks for having me, Mark. Great to be here.
Lou, the Coweta Samaritan Clinic is a tremendous story in this community. 4 years now?
Hard to believe, but yes, at the end of September we celebrated 4 years in operation. Patient base is up over 1,000 individuals, probably 750 to 800 of whom are active. We've had 9,000 patient visits since we started,
Wow.
Many of them done by Kay Crosby, our founding volunteer medical director, and Dr. Ernest Barron, who's been so faithful and tireless in his support of our work and his treatment of his patients.
Lou, Dr. Crosby's vision really caught fire in this community. You've got lots and lots of people engaged in this now.
We do, Mark, and we couldn't be more fortunate. We like to say Coweta Samaritan Clinic is the citizens of Coweta County caring for their neighbors, and that's true. No one or small group of people could have brought together what's happened here. Tremendous support with people sharing their time and talents as volunteers, and then the generosity of the community, starting with Coweta County Hospital Authority that provides our building to us at virtually no cost. A tremendous gift, almost 9,000 square feet. We just love the building and it's perfect for what we do. Newnan Hospital Foundation's been a vital and very generous donor with annual operating support since we started. Piedmont Newnan doing our labs and some of our flat film radiology for free. American Health Imaging now has stepped up with some of the more advanced radiology. You know, without these gifts in kind, we couldn't begin to do what we're doing.
Yeah, so you've got these institutional givers, you've got a lot of medical community givers, individuals who volunteer from the medical community or give their services.
Great point. Both at the clinic, we have 5 different specialists who come to the clinic once a month to see patients who are referred by our primary care physicians, and then many, many other generous and skilled physicians in the community who agree to see our patients at no charge in their offices.
Lou, the patient program that allows patients to get their medications, a key part of this.
Well, and as we grow, the demand for those medications grow. As I think we've talked over the years, Mark, most of our patients have one or more chronic diseases, hypertension, a lot of diabetes, things like that. We were shocked at how expensive insulin is, but thanks to the patient assistance programs of the major drug companies, we have a part-time employee, Laura Thomas, and a group of her volunteers, including several pharmacists, who help our patients enroll in the programs to get the more expensive branded drugs and then the insulin free of charge. The wholesale value of that this year will be in excess of $1 million of drugs coming in free. We don't have one insulin-dependent diabetic who's having to pay for their insulin, so
that's amazing.
It's a great aspect of what we do.
That is amazing.
Indeed.
You keep expanding services. So when you found that dental was a concern for many of your patients, you solved that problem.
Well, we solved it with the help of you and CEC and the West Georgia Technical College Dental Assisting Program. I think it's a classic example of the power of collaboration, but we, thanks to you and West Georgia Tech, come over here and use their dental lab on Monday nights. We have about 12 dentists in the community who faithfully give of their time at least one Monday night each quarter to see our patients and take care of their dental needs, a lot of it being just extractions and restorative fillings, things like that. But you mentioned many of our patients, we would almost say all of our patients need some dental care because, you know, that's one of the things that you give up, you know, when you're struggling to think about housing or how you're going to feed your family. You know, medical and dental care becomes secondary.
Yeah, yeah. Lou, the Coweta Samaritan Clinic recently has reached out again to the community, and the community has responded with support. The annual barbecue, among other things.
Well, can't say enough about Val Cranford and Sharon Gruber, who co-chair that event. It was our 5th annual barbecue. From everything we can tell, it was a record, probably about 700 people there. We should net about $135,000 from that. And The beauty of the barbecue, the way it's evolved, because all the chefs give their time. Dunaway Gardens is so generous letting us have that beautiful venue free of charge. Because of that, the individual ticket sales, Mark, more than cover the cost of the event. So the sponsorships, those major dollars, all fall to the bottom line and become available to the clinic for our services.
And lots of companies, lots of groups locally, lots of foundations have contributed to that.
Absolutely, and we have a number of those sponsors shown on our website, and you can link to their website from that. So, you know, we can't thank our sponsors and all the people who support the barbecue enough.
The Tony Barnhart breakfast is a wonderful event.
It is, and Tony comes down right before college football season kicks off. I'm just trying to think of some of his predictions for this year that may have gone awry already, but Tony is such a colorful speaker and very generous. This year, Mayor Brady gave him a proclamation. We made it Tony Barnhart Day in Newnan on, I believe it was August 21st when he came. He's been a great friend.
Lou, after all the great support that you've had, you've got a big announcement to make this morning.
We do. Thanks to Newnan Hospital Foundation. 2 weeks ago, they came to us with a wonderful matching gift opportunity, Mark. They said that they would match on a 2-for-1 basis donations to the clinic through November 30th, up to $100,000. Wow. So what that means is for every dollar we receive, they will triple it by adding $2. So every dollar means $3. We have spoken to some of our big supporters who have come forward already to help us in that effort, and we already probably have a little more than 70,000 committed to that. Wow. So it's an opportunity now to maybe ask the community to help out with that last 25 to 30,000 that would be matched, again, 2-for-1, meaning 75 to 90,000 for the clinic. So we're grateful for the support we've had from Newnan Hospital Foundation, their trustees, since our inception, and then for this wonderful gift. And if people would like to support the clinic, I believe there might be information showing on the screen, but checks can be made payable to the clinic and sent to P.O. Box 963 in Newnan, 30264. Of course, anytime people have questions about the clinic, or in this case, this particular matching gift opportunity, they can feel free to call me at the clinic, 770-683-6981. And I'm not going to try and do the email address, but hopefully it's on the screen right now.
It should be on the screen now.
Okay.
Lou.graner, Executive Director, Coweta Samaritan Clinic. What a tremendous story. Thank you for being with us on the link. Thanks for what you do and all those volunteers and all that great community support. We are Coweta citizens taking care of each other.
Indeed we are, and we couldn't do it without everybody. Thank you for having me, Mark.
Thank you, Lou. You stay tuned. The link will be right back.